So I think most of you know Dr. Danielson. He's currently the clinical professor of the Department of Pediatrics at the University of Washington School of Medicine. And you also may know that in November 2020, he made a most difficult decision to resign his position at the Odessa Brown Children's Clinic, where he had served for more than 20 years as the medical director. A very difficult decision he made, citing institutional racism and resistance to change inherent in the leadership at the Seattle Children's Hospital, which is now undergoing an independent evaluation. And you also may know that Dr. Danielson has been a leader for a more racially just and accessible healthcare system. And he's received many honors, including Citizen of the Year in 2018 by the Seattle Municipal League. Dr. Danielson has been described as a quiet, gentle soul who speaks from his heart, but he still calls for action. And I think Dr. Danielson is one of the outstanding leaders for healthcare in our region, and if not in the country. And it is really an honor to introduce him, and I thank him very much for sharing his time with us here at the Bree Collaborative. So Dr. Danielson, Ben, are you there?
I'm here. And,
there you are. Thank you,
for that introduction that I totally don't deserve. I really appreciate that. And I'm really honored to be part of your group today. I was going to share a few thoughts. I had some struggles in organizing the best way to approach this conversation, and I don't have that much time, so I'll jump right into it. But I was just trying to talk about the intersection between social determinants, especially, and racism in the way health and healthcare occur in our communities and in this healthcare system. So if it's okay, I will appropriate your screens for a little bit. Oh, I need to get permission for screen sharing from someone, if that's all right.
Who's got the screen? Is it Emily or Ginny?
I do. I will figure this out. Make you a co-host. I think that'll do it.
I mostly want to make sure there's enough time for us to have a conversation about any of these issues if you'd like. So I thought I'd just throw out some ideas and see where your group, which has been doing some amazing work, is sort of coming in these areas and the thoughts that you might share with me about them. Honored to be here and talk about issues around these issues of social determinants. And when you start to think about them relative to issues of racism, you have to have a historic and a place-based perspective in order to fully kind of take the things into account that need taking into account. You have to look at the spaces and places where communities of color have been either forced to live in or have created community around. And that means going back to the legacies of systematized racism and how that's impacted the opportunities for people to grow their wealth and their health and their families and their futures. So redlining becomes an important part of the story of social determinants today because there's a racist history to it in the past that continues to play itself out. We talk about the opportunity to be well, to be healthy, to pass on health and wealth to family members. There's a history that has to be taken into account. We're on the anniversary as of a couple of days ago of the Tulsa atrocity, in which basically what was a thriving and productive and advancing Black community was burned to the ground and destroyed by combinations of white townsfolk and police and the military. That intentional destruction of the possibility of well-being is a scar in our past, a scar in the land, but it also has an way of informing the way opportunity for wealth has played out for Black and brown families across time and continues to affect opportunities today, which means that that's a social determinant factor in the ways that we think about well-being. We talk about the history of the Black experience, the Black and brown experience. We look to the acts that people as individuals had to do in order to try to traverse what were social determinant barriers to well-being, and what it took to step into spaces where the barriers are high and where you're not welcome, and what it means to us today to think about how, in some ways, personal courage plays an important role in the social determinant story when seen through the lens of racism, and how personal determination becomes even all that more important when it's systematically difficult to enjoy all the rights and privileges that other parts of our society have. And when you talk about personal statements and the statements of the few, they become something much bigger than the one or two or three who are part of those statements, because they say something about the ways in which the determinants of well-being, the social determinants, are showing up in their lives, and the sacrifices that folks will make around their time and their spaces speak not only to what they believe in, but also what they hope and expect for other people in society. When we talk about the social determinants, we try to overlay with the lens of racism. We have to start thinking about what movements mean. And in what way is a movement actually a promoter of a social determinant of health for a group of people? In what way do the actions and the gatherings of people start to change the prospects for health and wellness for a whole group of people, a whole population of people? In some ways, if you are interested in the social determinants of health, you might also be interested in movement making and what roles we can play in actually promoting movements, both within our midst and our areas of focus, but also perhaps within our geographies, within our areas of influence and spheres of exposure as well. When we talk about the issues of social determinants and the intersection of racism, history very quickly brings itself right up to the present, and brings us into a space where the awareness, the approach to understanding, the desire to be in a place that is part of a solution as opposed to a more silent place that continues a problem becomes extremely important. And so in what ways does a racial reckoning, actually become in itself a process of promoting the social determinants of wellness for a community of people, for a population of people, for a nation of people, for everyone? Because the ways in which we see one corner of our society treated reflects very strongly on the ways in which everyone is treated in our society. So this idea of reckoning and its intersection with racism and with these social determinants, with the assessing what dictates health, becomes something that has to live both inside the walls of our healthcare system and, more importantly, outside the walls as well. It has to come with a sense of understanding of where we are, who we are, and how we got to where we are, and what we want our futures to be. We can name things as vital to the health of folks around us. We can name a public health crisis. We can step into that space. We can do that even through the lens of the social determinants of health. And then we have to ask ourselves, what does that call on us to do? What is it that we need to hold ourselves accountable to in order to really understand what it means to say that racism is a public health crisis, that racism is a social determinant crisis? We have to step away and past what has been a barrier for our consideration, for our conversation before, because we have to admit that in that healthcare system, there's a great fear of talking about racism. And I don't mean just there's a great fear in the past of talking about racism, or that there was a great fear of talking about racism on some levels. I mean, that today there's a great fear about talking about racism. You might have seen month and a half ago, I guess, this op-ed in the Washington Post from a Black physician trying to submit papers with the title racism in it, and kept having the medical journals replace the word racism with other words like intolerance. And when he persisted in wanting to make sure that that title, which was accurate to the topic, remained, he was threatened that he was coming off as an angry Black man. These issues of just not wanting to discuss, not wanting to understand and face and use the right language has been one of the biggest barriers, I think, in healthcare to understanding our role in perpetuating racism, and also understanding our potential role in addressing and undoing racism, both in the healthcare system and beyond. That means that there's some kind of, I think, very deep personal reflection that we all have to do as individuals. And I think in a way that is something that should be codified into the work of creating, say, tools for social determinants assessment and creating tools for understanding racism. It is not just cliche to say start with our own internal reflection and understand where we sit in that space. That's definitely something that was part of my journey in this past year and my decision-making process. And I mean an honest personal reflection of my own role, your own role, our own role, complicitly in perpetuating racism. How do our systems that sometimes try so hard to act on the individual level to make sure one individual has one unmet need met, how does that perpetuate the actual existence of oppression for so many people? Because that energy is used to stave off something in the moment, and other energies should be used to actually be moving upstream, to be moving to the roots, to be moving to the systems themselves, and really addressing them at the same time. How do we do that kind of reflection of ourselves, of our systems, of the way that we even think about things? I have to tell you, as a pediatrician working in a low-income clinic and kind of having to really face that moral question, am I making a bad healthcare system just seem a little bit better for now? And does that mean that it just perpetuates a bad system? Are we acting at the right level? And that doesn't mean you have to choose one, but it does mean that perhaps you have to think about the many levels and the many different ways that you can be influential in them. Because when we talk about social determinants and we understand the way health plays itself out, it has such a place-based, such a social, and such an interconnected component to it that if you're a public health chart and graph maker, you might have the easiest job in the world, because you can name all of the same mappings of health outcomes and just change the titles and you would be accurate. That's how much the overlap of not only the history of things like redlining and the history of things like really depriving economic opportunity, but the presence of health and well-being today continues to play itself out. That's how these things continue to be connected. And when I think about social determinants, there's so many different ways to sort of categorize and model them. But in this intersection with racism, I made this up, so there's not a great resource model for you to sort of look back to on this, but this is one of the framings that is something I go to, which really looks to these overlapping, intersecting spheres of economic alienation, toxic stress, and racism and oppression. One reason that's important to me is that sometimes in the past, in that desire not to talk about racism, we've created solutions that have focused on things like poverty or economic alienation instead of addressing issues of racism. Now, addressing issues of economic alienation are important, but you just need to know what you're doing and why you're doing it, and not trying to substitute one for the other. It's also important to really recognize how much overlap each one of these has, such that anybody can face toxic stresses. This last year or so of a pandemic has taught you that no matter what, you can face incredible toxic stress. But when it overlaps and overlays with racism or oppression, and then with economic alienation, then the triumvirate becomes especially potent and effective in your life, such that if you're in the major cities in this country, it's still true today that the amount of median family wealth, not income, wealth that you're able to accumulate is so dramatically different if you're white, if you're Latino, Latinx, or if you're Black, African American in this country. The wealth is almost immeasurably small if you're a Black family or a Latino family in this country. And the ability to keep elevating a generation after generation, the ability to use the social determinants in order to advance well-being across generations is curtailed, such that as we start to continue to do this land-based approach to impacting the lives of others, with gentrification and with the ejection of some communities from areas that they've traditionally been in, then that becomes its own social determinant of well-being. It becomes its own decoupling from the opportunities for generations to build well-being from families along the way. And it means that we continue in a process that is many generations long now. I just put this up there just to disprove the sense that sometimes people want to say that we've been making general progress across the board as a whole, and it's just that the progress of one group hasn't kept up with the progress of another group. Well, some of that is really directly refutable when you look at things like home ownership rates in the Seattle area and how those have changed over the span of the last 50 or so years, and what that has meant for those communities, again, in terms of a social determinants perspective. The social stressors, the toxic stressors, is something that, of course, in pediatrics, and I think across the healthcare system, the idea of adverse childhood experiences has been well-founded and well-studied and well-documented. And I do wonder sometimes if we should have an 11th ACE in coronavirus now, because that has been such a pervasive impactor on toxic stress for everyone. But as you add those up, then of course the impact of that is steadily increasing. That coronavirus plus an incarcerated relative plus emotional stress and strain plus physical abuse make for deeper holes that will be harder and harder for communities, for families, for individuals to really emerge from over time. And we risk celebrating recovery for a privileged group of people and losing our perspective on addressing the needs of so many others because of the deeper hole that we've been digging for some groups. We know in the healthcare system that sphere of racism and oppression shows up in just about every measure of health and health outcomes that go back to 2002's Unequal, that compilation of all the ways in which disparities in healthcare tend to show up. I think that there's no greater tragedy than the risk for health in what should be one of the most beautiful events in a human's experiences, which is giving birth, which is adding life to the world. And to know that if you're Black, if you're African American in this country, if you're a pregnant Black woman, you could have graduate degrees, you could sit in a Zoom meetings like this, you could be the greatest tennis player of all time, and yet in this country, you're still at greater risk for dying in childbirth, and your child is still at greater risk for dying in infancy than if you're of any other racial category, in any other economic category, which shows again how economics and race just do not overlap in the social determinants realm. And it's not just about the outcomes of treatment in our healthcare system, although those are important. It's also about how you're treated as a family, as a person, when you cross the doors and enter our healthcare system. And this just as one example of the chance of being policed, of having security called on you, varies by the color of your skin. In our healthcare system, and in this specific example, because it's been studied in this hospital, it's not just the outcome, but it's the process and the treatment that really matter to the way people experience health and the way that the social determinants actually enter the social setting of the healthcare system. These are all important. They all affect us. They're all the things that make us aware of the many different ways that lives are shortened in our country by the social determinants intersection with racism. How if you're a young adult Black male or female your chance of being shot by the police unarmed is 3 times higher, and how it becomes actually a risk factor, so that when I'm doing social determinants like screenings in a well child visit for a 14-year-old, part of our discussion is about how to survive interactions with police, because it is, for at least for a 17-year-old, it is the 7th leading cause of death for a young Black man. It sits right there with kidney disease and all of the other health risk factors that we have plenty of anticipatory advice about. These epidemics of the ways in which the social determinants and racism lead to a divergent path for different populations is just important for us to consider, not only as really thinking about root cause and root analysis of where social determinants emanate, show up, and are passed on across generations, but also root outcome. So how do the social determinants issues actually play out, not just in your asthma care, but in the chance that you will have a trip to incarceration as part of your future. These issues are important, and they have to be taken into context that knows that our systems are actually not broken, but they are actually working exactly the way they are designed. The machinery of our healthcare system, of our economic system, of our judicial system, of all of those systems, education, is actually working the way their fundamental programming is designed for, which means that, I don't know, sitting in a clinic for me is personally rewarding, but it may not be addressing the extra bad machinery when I keep thinking that all we need to do is fix machinery. I don't know if that makes sense, but something we could talk about more. It leads to this philosophical point for me, which is maybe worth making or not, that just, we had one great person, the Reverend Dr. Martin Luther King Jr., talk about this moral arc and how it just inevitably heads towards something more like justice. But I prefer the reformed statement from another great person, President Obama, who said, it doesn't do that by itself. It does that if we actually exert our will in this process, that if we are active participants in this country, in the ways in which social determinants and racism play out, that's when the moral arc curves. Otherwise, it goes straight on doing what it's always done. Which means that if we're thinking even in healthcare about what it means to support the social determinants, then we should be really thinking about ourselves as activists who promote voting and voting rights. And we are still in a time where Jim Crow laws are being promoted and promulgated across this country, where we stand up for everyone's rights, and we recognize and we decry it when a group of people, when Asian Americans are being subjected to the threat of hate, the act of hate, and the violence that comes from hate again and again in this time that we need to be thinking about our reckoning. We should be arcing our own thinking towards a deeper understanding of each other, of the ways in which maybe the toolkit that we use for a social determinants assessment is a toolkit that is actually more about understanding somebody than listing and naming the particular factors or individual components that might describe their social determinant position. This work is so important, especially because it means that we have to reframe some of the ways we center our ideas and our efforts to make sure that those who are most impacted by the worst factors that really create the hardest paths from a social determinant, from a racism, from a general thriving perspective in this country, that their voices are deeply centered, are the actual voices that name the ways in which solutions are arising. That work has to happen in a way that really understands all of the intersections that come with the way we talk about social determinants and the way we talk about who we are as people, our identities, and the ways that they overlap and the ways that we understand them. Because all of these things interconnect, and to really think about issues of environmental justice is to understand that environmental justice weighs more heavily on low income and communities of color, and therefore the intersections there are really powerful, and the solutions there are also equally powerful from a racism and an anti-poverty perspective. It makes us think about, as we move wherever we're moving from this pandemic, be very careful about wishing to go back to normal. Be very careful about people talking about normal, because normal, if you really look at that history, is inviting us to continue on a path of harm, of racism, of making sure that the social determinants are at the bottom of the scale for too many people that we say that we care about in this country. We need to be really thinking about how to center the communities that we serve in ways that help them determine their own approaches to healthcare, to health, and to wellness. That we need to really, I think, reinvigorate conversations about whether our healthcare system is working at all, and whether or not our investments in public health have been adequate, whether or not our approach to privatized or nonprofit healthcare is adequate and working. It means that we have to be much more intentional about supporting and serving the needs that are a tidal wave, that are a tsunami building up, especially for communities of color, but across the board for communities everywhere. And how will we be ready to address that? Because if we are not building the resources to support that right now, then we are building a future where the social determinants, where the effects of racism, where the impact on health and well-being are going to be deeper and deeper and deeper in terms of their negative impacts. If we are not building a way to create not only measures of social determinants, but directions towards hope, a sense of hope and of something better, then it might not make that much of a difference how much we utilize a toolkit per se. It might not be useful to somebody who doesn't have a sense that something better is possible and that our society owes people something more. That if we don't name what we really value, the importance, say, of the integrity of families, and that we don't decry when the integrity of families is violated at our borders or anywhere else, then we cannot stand up and say that we are supporting the work of social determinants for the communities around us. If we don't stand for the rights and the needs of every community, especially our LGBTQIA plus communities, especially now, again, when we see legislation, when we see state action that is trying to undermine the rights of many different groups to care, to the health care that we provide, and to the supports and the recognition and the dignity that they deserve, then we're not doing, I think, our job from the healthcare realm. If we're not talking about the things that we have some weird addiction to in this country, and I think one of our worst national addictions in this country must be our addiction to guns, and it must be an addiction because it is the continued use of something that is absolutely proven to be deadly harmful to us, and our strong desire to continue to use it despite the overwhelming proof of its deleterious effect on ourselves, on our bodies, and on society. If we're not talking about those from a social determinants perspective, then I don't know what we're talking about. If we're not talking about making cultural relevance and cultural celebration as important a part of the way that we promote well-being, the way that we recognize the assets and the strengths, in addition to naming the deficits and the needs in different communities, then I don't think we're going to move into a space where we're actually realizing better health and well-being for the communities that we care about. If we're not promoting diversity and difference within our realms, within our ranks, and within the spaces that we are working and striving, if we are not doing what we need to dispel the myths of diversity, to dispel the myths that you need to compromise quality for diversity, then we're not creating pathways, the opportunities for undoing the economic harm that has happened over generations and generations. We're not creating the pathways of hope and respect, and we're not creating a better healthcare system that is informed strongly by a diversity of thought and ideas within its ranks. These are the things that we need to do, and I think in so many ways the outcomes that we need to be measuring towards need to be something, I think, weird and aspirational, like the aspiration of making sure, I don't know, for me, that a child knows and loves themselves, that a community knows, understands, and loves themselves. It has a sense of not only being respected from the outside, but being loved and appreciated, and has a sense of self from the inside as well. If we can work towards that, we would be transforming societies in a powerful way. If we are thinking about the work that we need to do as just a helping hand, then I worry that that is different than actually addressing the underlying problems that lead to the social determinant problems that are informed by the racist problems that we have in this country. If we don't move away from a scarcity mindset, and I wonder and worry sometimes that not only in healthcare, but in the way that you even talk about public health and resources and social determinants, is there a way for us to talk about that in a way that does not evoke scarcity? Because we are not a country of scarcity. We are not a nation of scarce resources. We are not a nation that should countenance scarcity as a reason not to do something or to do something in the ways that we do our work. Our desire, I think my desire in all of this, is to make sure that every step of what we're doing is something that is not only saying we're going to be better from here forward, but that acknowledges that we have reparative work to do to actually understand and promote the healing that has to start with an acknowledgement and a sense of accounting for our past. We need to create the spaces where each of us is seen and heard and understand, where I don't have to enter groups wearing a mask and using a particular language lest I be called an angry Black man. I so appreciate that introduction about something quiet dignity. I forget what you said, Hugh, but that is both a compliment and it may be a sign of my own complicity in not speaking out enough, in being afraid that if I did speak out that it wouldn't be welcome, and in not showing up with the fervency that we need to these days. I really hope that when we talk about permanence, there's such a strong sense of asset, because I think a recognition of the assets in the communities around us are an important way to start to unwind the racism that is built into the ways that we look at difference and different people. And I hope that, I don't know, that we start considering things as lenses for the tools that we use when we talk about how to improve the way we pull racism into the conversation, uncover our eyes and our ears and our mouths and really talk about this. Is there a way for the tools and approaches that we use to ask some questions? I don't know what they should be. Maybe they should be something like these, some place in here, some combination of these. Are we centering those most negatively impacted when we try to make a decision? Have we made assumptions about people's strengths or their needs, their assets, or what they care about when we design things for people instead of with people? Where does our work sit in those overlapping spheres of economic deprivation, stress, and racism? Are we artificially using a toxic stress tool and thinking that it's going to help with racism or with economic deprivation? Has there been an opportunity for people to share their stories? Because the expression of story, I think, in our healthcare system is the ingredient that makes people feel respected, seen, and heard, and helps us start to understand that our version of reality is not the only one. Are we leaving someone out when we make this decision? Their transportation ability, their disability, their language, their voice. I've seen that so many times in this past year, especially with many of the programs that have come out to help address the COVID pandemic, that just intentionally leaves essential workers or non-car drivers or other people out. Has disaggregated data informed this decision? Do we demand disaggregated data when we start to create and formulate our plans and ideas? These are just some things that I was just wanting to wonder about and see if there are ways for considering
a different meeting right now, and I'm not on that. Dang it.
non-numerical.
Please mute. Please mute.
And I know it makes it hard for the work of a group like yours to do this, but I imagine these are some of the conversations that you have as well.
You better ask me if you have something to say. You better talk to me now if you have something. Okay,
one last thing, because I was looking at the work that you're doing, the many different kinds of work that you're doing. I saw the Bree Collaborative was really contemporaneously involved in the total knee replacement space and creating some algorithmic and supportive work about the bundling and such of those services. And wondering, it just occurred to me that everywhere is an opportunity to try to understand the racism that plays into this. I mentioned in some setting, I just had a total knee replacement, and I would count myself extremely lucky, because if you're a Black male in this country, you're 50% less likely to be offered a total knee replacement when you show up with the symptoms that would indicate a total knee replacement. When you're a Black male, the rate of complications actually goes up. And some of that is because you're more likely to go to a physician who doesn't do that surgery as often as someone else. When you're a Black male, you're also more likely to decide not to do a total knee surgery, partly because you don't have a trusting relationship with the healthcare system. So you take one example, like work that you're already doing, like the total knee replacement effort. Is there a space to insert a conversation about racism and the work that could be done to address racism, so that those 72,000 quality adjusted living years, not just mortality and morbidity, but the quality of life that might happen in the last decades of your life because you can walk better and move around better, maybe contribute to society in a different way. How are those conversations relevant to a lot of the work that you're already doing as a collaborative? Just through that in there is just a wondering as a point of conversation. I admire the work that the Bree Collaborative is about, because the way I understand it is really a getting up from the sidelines of watching the way healthcare is practiced, how it's what it produces in so many ways, and really thinking of being an active participant in the reformation of the way healthcare is delivered. And it's done across a broad partnership, which is really powerful, because I think in our society, the greatest harm doesn't come from the most evil people who might have been recent presidents, but it comes from the harm of the most passive people who have good hearts. Those are the kinds of things I just wanted to talk about, mention, and I'm wondering if there was conversation that others would have around anything that I was just blathering about with some bad mural artwork and random thoughts. Thank you for listening, and I hope some of this was helpful.
Oh, Ben, thank you. That was extraordinary. A wide range of things to think about. I would invite people for comment and question with Dr. Danielson from the Bree. My question, let's see, in the chat.
Yeah, Hugh, this is Karen Johnson at the Alliance. I put that in the chat. This was a health affairs blog that appeared yesterday. Time to take a new look at how we talk about low value care. And it's hit specifically on the message, Dr. Danielson, that you were giving around knee replacements. You know, we talk a lot about, you know, care, overuse of care that people don't need. There's a whole lot of people not getting the care they do need. And it's, I think, changing the narrative from one or the other to making sure that we improve the value of care for all in ways that are equitable and fair and just is sort of the narrative that I hear in what you're saying, and I really embrace. So thank you for that.
Oh, thank you for adding to that.
Thank you. Others? Comments?
Can you talk, hi, Dr. Danielson, can you talk about the importance of representation and workforce development and working within the current system and the importance of that?
One thing I'll say is that if you've looked at data, then you will be relieved of this myth, but there's this myth that we are diversifying our healthcare workforce. And we are actually not. We are not keeping up with the diversity of our communities. And according to one paper that went out in February, I want to say, at this pace, it'll take a century for the healthcare system, training medical students to residents to physicians, training nursing students to nurses and physical therapists and all of that. It will take a century to catch up with the diversity that's out there. Basic representation of the workforce to the communities around it is just essential and important. Beyond that, the gifts that come from so many different lived experiences is so powerful, so much more powerful to be in a group around a table, maybe a table like this, where people disagree with each other and bring different wisdom to it than it is in a chorus where everyone always says hallelujah and agrees to everything that everyone says. When it comes to actually addressing issues of racism, the value of a young person seeing somebody who looks like them is so valuable to the future that we all want to see. The value of me I went to a Black surgeon to get my knee replacement. It brought for me a different kind of trust. It's also a surgeon that does 400 or 500 of these a year. So I know my quality reports that I've read from you all, but there's also a black physician. And that's meaningful to me because my sense of trust is probably a factor in my outcome when it comes to the way the healthcare system works. I think there's just myriad other reasons why we need to pay a lot more attention to the diversity around us. And then that picture of the woman taking off her white mask. I'm still from the generation, I think, of wearing a mask and showing up in order to be acceptable to a predominantly white profession. And we not only need to gain numerical diversity, but we need to gain authentic diversity with authentic voices where folks are actually encouraged to be audaciously bold and brazen and talk and say and share the cultural experiences that make them who they are, brought them to the spaces that they are in, and make us all better.
Wow. Thanks.
It's
One more. Yes, Mary Kay.
Mary Kay. Thanks so much, Dr. Danielson. I based in part of my own personal clinical history, I'm very interested in hearing what you think about us trying to understand the whole area of the ACEs research better. And I know there's been some wonderful work done on it, but I feel it's been kind of sequestered in pediatrics, and I'm pretty sure people don't age out of it. So so I feel like that's should be top of mind variable. What is this person dealing with? And then I've been thinking about all the PTSD literature that comes out of traumatic experiences like this, and then dropping it on people that have this as a baseline that hasn't really been dealt with yet. So no magic wands, but just would love to hear your thoughts.
Yeah, you said everything that I would have said. I also think that the ACEs work, which again, doesn't talk about racism, doesn't really talk about socioeconomics, was based on mostly middle class Kaiser families. But what it does philosophically is say that the work that you do to understand people's experiences in their lives is work that actually helps you understand where their health is going and where it's come from and what's happening. And so, can we continue to evolve our approach that began with ACEs? And maybe, now people talk about adverse community experiences, and people talk about races, right? Racism and adverse childhood experiences. And so can we continue to evolve that concept just as we continue to work hard to evolve everything from the quality of services we provide to the ways in which technology helps us do things better? And I agree with you, that's a lifelong, generations long, generational ACEs. There's a whole nother great, I think, set of conversations that are happening. So it sparked all of these conversations. It sparked you to advance our thinking with your wisdom about nobody ages out of ACEs. I think that's the beautiful part of it. And let's not let ourselves be limited by something that was remarkable and specific.
Thank you.
I hate to close this because I think we could go on for a long time. And I want to thank you, Ben, Dr. Danielson, for sharing your thoughts. But you are a quiet and humble man, but you're also a courageous man calling for action. And I think your own example is one that we should follow. We need to do our own self-reflection at the Bree. We have to understand how racism affects our work and the implementation of our work. And we can name it, and we have to understand and name the systems that are underlying the disparities that exist in health in our country. When we can do that, we may begin to see the change that you're calling for.